So there's a patient just in the other room about to go in to review their findings, their testings, really the Toronto Clinical Scoring Evaluation, other tests that we ran. We were actually getting their intake earlier today, and they told me that a year ago they went in just for a simple outpatient surgery. Now, a year after this surgery, he's telling me that he's got numbness in his feet. It's actually mostly in his toes, a little bit down into the ball of his foot. Recently starting to get numbness up here as well. And then these two fingers here in the last couple of months have started to bother him. And then also the last couple of weeks, his legs are extremely swollen. Trying to get out of a chair, he can barely get out of it. His legs are so swollen, his muscles are really weak. Now that simple outpatient surgery was a neck surgery. They went in through the front, and what actually happened is they accidentally cut his larynx. What that meant is he couldn't swallow. He couldn't breathe. They had to put a tube down his throat, and it actually got a blood clot in his neck and then also down his arm. Now, because of this, he was actually in the hospital for 6.5 weeks for what was supposed to be a simple surgery. Now, since the surgery, his neck mobility is about as good as that. And he's walking, he's moving, but he has all this numbness in his feet. They had to go in and do a second surgery to clear out really this, and he's still having trouble swallowing. He still can't do that normally. And they've been trying Gabapentin, but it made him feel like a crazy man. He said like he was never going to do that again. He had really bad mood swings, things of that nature. Really affected his wife quite a bit. And some of the other things with this case history is because of the way his body was like exposed, where the hardware that they had was exposed to the outside so much, they put him on multiple different rounds of antibiotics. And I asked them which ones. They said every single one you can think of. Now the unfortunate thing is that a lot of antibiotics actually have side effects of neuropathy. And this is really what we discovered, is that some of these, which one he actually started 2 weeks ago, which we're now a year exactly, April was when he had his surgery, or a little bit over a year from that surgery. 2 weeks ago, he started the Cipro medication, and this swelling in his legs started, and the balance and all those issues where he actually can't get out of a chair, etc. have started. And because of that, that's also a known side effect of this medication. And so this is the type of patients that we see here in our clinic. This gentleman actually drove 1.5 hours to come to our clinic because the surgeon, the orthopedic, and all these other physicians are basically just giving him medications and just shrugging their shoulders saying they don't know what to do. Now, if you or someone else has a complex case like this, or you're struggling with these types of symptoms, you need to leave a comment, give us a call, shoot us an email, or send this to someone who might be able to help. Because although this gentleman has severe and really, unfortunately, is really progressive neuropathy, we still might be able to help. So leave a comment and hope we can help.